Hi guys, so the sternoclavicular joint is a saddle type synovial joint that is proximal to the bonobrium of the sternum and is also distal to the clavicle, so it would be around this area. The SC joint is actually the only attachment of the upper limb to the axial skeleton, and it has a large degree of mobility, so therefore it works kind of like a ball and socket joint. The movements are elevation. You elevate your shoulder, kind of like shrugging it. And then the muscles responsible for this are the trapezius, which is right over here, the rhomboid minor, the rhomboid major, and the levator scapulae. We also have depression, which is the opposite of elevation. You kind of move your shoulder down. And the muscles responsible for this are the pectoralis minor, which is a deep muscle, and also the serratus anterior, which is also a deep muscle. We have protractions, which is basically moving the shoulder girdle anteriorly. So you would go like this. And also the pectoralis minor and the serratus anterior, which are both deep muscles, are responsible for these movements. And then we have retraction, which is the opposite of protraction, which is moving the shoulder girdle posteriorly, like this. And then the muscles responsible for this are the trapezius, right over here, which is superficial, the rhomboid minor, and the rhomboid major. And I forgot to mention this, these muscles here are deep muscles, like the levator scapulae, as I mentioned before, the rhomboid minor and the rhomboid major. They're all deep muscles. And then we also have rotation, which is kind of moving your arm up and back, up and back. And then we have the movement at the scapula at the AC joint, and that joint is called acromioclavicular joint and is a plane type synovial joint that is in the lateral end of the clavicle where it articulates with the acromion of the scapula. This joint can actually be palpated during a shoulder examination. All you have to do is kind of put from 2 to 3 fingers, depending on obviously how big your fingers are. But it should be from 2 to 3 centimeters medially from the tip of the shoulder. So moving towards the middle, 2 to 3 centimeters. And this joint actually allows a degree of axial rotation, which is what we did before, moving the arm up and back. Exercising is actually very important, which in this case, it builds flexibility and strength. And some things that you can do for it are the swords, which is at the gym. I don't know if you guys remember, but there's like this thing that you kind of go like this. That it's like a string, and it's at the floor, and you kind of have to pull it up. That's actually a really good one. Or you can actually do push-ups as well. Or the ones that it's kind of like the sword, which is what this is called, but it's both of them. I believe it's called the band pull-aparts, which is both of them like this. You would actually be working out both at the same time instead of just one. Thank you.